Non-compete clauses in family medicine contracts, and the network exclusion problem. A geographic non-compete in a family medicine contract reads the same as any physician non-compete. You agree not to practice medicine within a stated number of miles of your current employer for a stated period after separation. The standard range in primary care is 5 to 15 miles for 1 to 2 years. That is how it is presented. That is not what it means in a family medicine context. Here is the practical problem. Hospital systems that employ family medicine physicians operate networks. A regional health system may own or be affiliated with multiple outpatient clinics, urgent care centers, hospital-based primary care practices, and federally qualified community health sites across a 20 to 40-mile radius. A non-compete clause in a hospital-employed family medicine contract does not restrict you from working within the stated radius of the single clinic where you practice. It restricts you from working within the stated radius of any facility in the health system network. In a mid-sized metropolitan area where a single health system operates 6 primary care clinics, 2 urgent care locations, and a network of affiliated community health sites, a 10-mile radius drawn from each facility can cover every accessible outpatient practice in the region. The clause that looked like a limited restriction is a functional prohibition on practicing primary care in your city. The family medicine-specific amplification. Patients follow their physician. In specialty medicine, a patient losing their physician to a non-compete is an inconvenience. In primary care, a patient losing a family medicine physician who carries their longitudinal care history, chronic disease management, preventive care continuity, pediatric and adult panels, is a care disruption. Health systems know this. The non-compete in family medicine is not just about protecting market share. It is about protecting the patient panel, which is the downstream revenue asset. 2 questions to ask before you sign. First, how many facilities does your employer own or affiliate with, and what is the combined exclusion footprint when the radius is drawn from each one independently? Ask for a list of affiliated facilities by address. Draw the circles. If the combined zone covers your metropolitan area, you are signing a contract that requires you to leave the market, not leave one clinic. Second, does the non-compete include a rural geography carve-out? Many state courts and some contract templates now include provisions that reduce enforceability in rural or underserved areas. If the position is in a rural or health professional shortage area, the non-compete may be negotiable or subject to statutory limitations depending on your state. 2 protections to negotiate. A single facility clause that limits the restriction to your primary practice site only, and a termination carve-out that voids the non-compete if the employer terminates your contract without cause. Read the non-compete in geographic context, not just geometric terms. Run your contract through ClauseLine at ClauseLine.com.